Hi everyone, today I want to talk about the Osseodensification system. As you know, we mostly and traditionally use standard drills to prepare the osteotomy for implant insertion. These drills excavate the bone to make room for the implant, and they are made in twisted or fluted shapes, which causes chatter during the drilling process and doesn't make a precise circumferential hole for the implant. This causes less primary stability for implant and decreases the insertion torque of the implant, and in fact we're losing the autogenous bone. Of course, this is okay when the bone has adequate density and there's no problem in the horizontal or vertical dimensions. But when the ridge is narrow or when the density is low, for example in the posterior maxilla or after sinus grafting, this could pose a problem, and we could lose the primary stability of the implant, or we could need additional GBR procedures, which adds time and cost to the overall treatment. This is where it gets interesting. In the osseodensification burr system, the bone is not excavated, but it is compacted and autografted to the lateral walls of the osteotomy, so we're not losing the valuable autogenous bone anymore, and it can cause expansion in the bone, and it makes a precise circumferential hole without elongating the hole or making it elliptical, which causes the increase in BIC, the bone implant contact, and increases the primary stability. How does this happen? It's because the osseodensification burrs have more lens, which guides them precisely during the osteotomy, and they are used in a different mode, which is the counter-clockwise mode. The expansion and compaction that is induced by these more lens and the counterclockwise system that we're using the osseodensification burrs with increases the bone density and causes a controlled bone plastic deformation. And the residual strain that is created, which you need to be really careful about, can cause osteogenic activity, provided that it is used with a copious irrigation and pumping or bouncing mode, like an in and out fashion, or the insertion torque is really gonna increase. So you need to be careful about that. Okay, so let's get into it. We have the pilot drill here, which we need to use in a clockwise fashion or in a cutting mode. And we have three sets of drills here called the VT5, VT8, and VS8. The VT5 and VT8 are used for tapered implants, and VS8, T is taper, S is straight, and V is the Versa system. And VS8 so is used for straight implants. For the soft implants, we're gonna go in a linear fashion. For example, I'm gonna use the first line or the second line. But what if I want to do expansion in a dense bone? For example, I want to do ridge expansion in mandible when the density is high. So there, I want to increase the dimension of the osteotomy incrementally, little by little, step by step. So I'm going to go from the 2 diameter to 2.3, then 3 to 3.3, 4 to 4.3, and 5 to 5.3. So I'm going to go in a diagonal fashion. And if my implant system is straight, I'm also going to use the last row here. And the speed is 800 to 1500 round per minute. And the drills need to be changed every 12 to 20 times according to the manufacturer. The dimension of the drill is 8 to 20 millimeters. The first line is 8, then we got a 10, 11.5, 13, 15, and the highest lines are 18 and 20. Also, we need to account for the Y dimension, which is the end of the drill, which is an extra 1 millimeter at the most, which needs to be included. In the soft bone, you're gonna drill 0.5 to 0.8 millimeters less than the diameter of your implant, and in hard bone, this is gonna be 0.2 to 0.5 millimeter less. So that's it. I hope you found this video useful, and I hope you're successful with your osseodensification system in closed sinus lift and bone expansion. Good luck.